So
We're good to go. Thanks, everybody. Thank you all for being here. I'm happy to call our meeting of the board to order. Please note the board members that are with us virtually. But let the record show that we do have a quorum. We'll dispense with the reading of the minutes unless there are any additions, deletions, or corrections. Are there any? Be happy to entertain that motion. All in favor of approving them as presented, please signify by saying aye.
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 And opposed? Thank you, that motion carries. But before we get into the meat of our meeting, I want to make two announcements. The first is that the governor, that she has appointed Judge O'Donnell to our board, representing the Senate. And Judge, we're thrilled to have you, so welcome.
I'm thrilled to be here. Thank you.
We're very pleased that you will join us. We will burden you with all sorts of materials as time goes on, but thank you for your willingness to serve and be part of our group. Thank you. And in that context, Congressman Quinn is moving off of the board, but I'm equally as happy to tell you that Jack has agreed to move on to the foundation board. So I'm very pleased that Congressman will continue in his service to the hospital, and he was very happy about doing that. So we'll go through that process as soon as we do the nomination, which actually are happening now.
Yep.
So all good. So Judge, welcome. Congressman Quinn, if you're listening, thank you, and we'll do the proper. We'll give him a proper send off at some point.
Yes, absolutely.
When we can.
Sorry. Apologies.
Dr. Grimm. On the service contracts, Ms. Persico?
Yes, the contracts committee met on 10/20 and reviewed the contracts, which are, I think, in everyone's packet, and made a unanimous recommendation that not only the new contracts from July 1st, 2021 through September 30th, 2021 be approved by the full board, but also performed our annual review of previously approved contracts and would request that the board approve those as well.
Any of note, Jen, that we need to talk about?
This go around, there really wasn't anything of note.
Okay, great. Motion's been made by Jen Persico. Is there a second?
Second.
Second by Ms. Hanson. Any further discussion, conversation, question? Seeing none, all in favor, please signify by saying aye.
Aye. Aye.
And opposed? That motion carries as well. Now, I know, is Dr. Cummings on the call, or?
Yes, he is.
Dr. Cummings? Hello, Dr. Cummings.
There we are. I'm
You-
sorry, I apologize. This is the trials and tribulations of being part of a mobile team here. So hopefully you guys can hear me. Can you hear me, John?
Are you driving or are you the passenger?
Well, I am the passenger who has stepped out because of the lack of my Wi-Fi signal. So hopefully you can hear me, and I apologize if the board cannot. We have a really short presentation from our perspective in front of the board today for your consideration is the Credentials Committee from this month, which involves, I think we had 15 resignations, 15 initial appointments, and 32 reappointments, as well as the minutes from yesterday's MEC, which involves three items that we voted on fully yesterday, two housekeeping, really joint commission regulations involving OPPE, as well as job descriptions through the imaging department, which are joint commission requirements that are in your packet, as well as several additions to the bylaws. So I apologize for the bad connection, but I'm certainly here to answer any additional questions if anyone has any.
Thank you, Dr. Cummings. Are there any questions for Dr. Cummings on the medical report? Motion's been made by Dr. Cummings. Is there a second?
Second.
Second, Jen Persico. Any other comment? All in favor, please signify by saying aye.
Aye.
And to the contrary. That motion carries as well. Dr. Quattrochi.
Okay, thank you very much. Trying to see if here we go. So obviously we always start with quality and just an update on the vaccine mandate. As you know, we have about 3,000 hospital staff. To date, we're at about 1.3% of the staff still on unpaid leave. As of November 1, if those staff are not vaccinated, they will be terminated from employment. We do also have a fair amount of employees on religious exemptions, and those are being assessed by the committee kind of one by one. So some individuals will be approved and some will not. Terrace View, we have 474 staff total there, and about 6% of the staff on unpaid leave there. So again, we had staffing issues at Terrace View before the pandemic and before the vaccine mandate. So that always only exacerbates it. We've been working with the unions to find additional staff, and Joe Gilly and his team have done a really good job of actually finding some agency staff to help fill the gaps. And as I talk with the unions, I say, we don't like agency, they don't like agency, nobody likes agency, but we have to use them. So they get it, and they've been great partners with us because right now I believe we have about 500 positions open.
Are those local agencies or are those national agencies that are bringing people in?
A little bit of both. Joe, can you talk about local and national agencies and who we use?
Yeah, we use 3 agencies. One of them is local, another one is national, but they recruit from local sources. So, I mean, the problem is, some people are taking off to go to agency only to work across the street for $100 an hour through that agency. That's a systemic problem that's going on across the United States right now. Although they're national, they try to recruit locally because it's more convenient for the staff, clearly, to work in their own backyard. But that's what we're facing right now.
Joe, did you say $100 an hour?
Oh, yes.
And actually, across the state, people have been quoted as high as $250 an hour.
An hour.
An hour.
Correct. Right now, and I'm just taking this from what I know about the resources that are contingency plan. That contingency plan staff, for strikes and situations like that is about $150 an hour.
Not cheap. So that's why.
It's like baseball players.
As I said, we don't like agencies, and the unions don't like agencies, and nobody likes using them. But at the end of the day, that we use that sparingly. Before the pandemic, we were almost down to 0, and many other institutions were not able to do that. So.
I have that.
Well, hey, Mike, can you put your phone on mute, please? Thank you. Okay, back to kind of things we've been doing. I know I've covered this. So I'm not going to read all these. I think since the last time, the only thing we did differently is we did incentivize employees to take extra shifts. We have moved that from to the weekends, from 7 days a week. Frankly, financially, that was the reason we did that. We were kind of monitoring that. So we do still have extra shifts on weekends. The biggest, we do have need in the hospital. The biggest need is Terrace View. So that seems to have worked. And actually, to be honest with you, the extra pay for extra shifts actually encouraged some people to get vaccinated and come back to work because they want to take advantage of that. So kind of an unintended consequence, but it is something that did happen. Again, COVID patients, we've treated 1,496 patients to date from the pandemic. You can see our length of stay has gone up. That's mostly due to the fact that we're not able to place individuals in the community, the dynamic we've talked about with nursing homes closing units. So that's the reason that has gone up. And currently we have 14 COVID patients in-house. That's a little less than we had about a week ago. It was running about 20, but it has recently gone down.
Any of them are ventilators?
I believe we have 4.
4?
We broke another record on October 11th. We had the highest census to date, 562 patients, and I believe there was about 30 patients waiting in the ER at that time. So again, the team has been doing an amazing job managing this, the level of patients that we've had. And we'll talk about statistics a little bit later, but we had, again, weekends where we had 20% left without being seen. So 1 in 5 people are walking in the ER and walking out. Obviously, that's a concern for everyone. And not unique to us. Buffalo General, for instance, is facing the same kind of challenges. Believe it or not, it's time for Joint Commission again. They're coming next year, so we have a mock survey that will be coming up soon. It's unannounced, the mock survey, as is the actual survey. And we have a full, again, 3-day survey going on, mock survey going on before the actual one comes up next year.
Who's going to lead that? I think that's Charlie.
Charlie leads that effort. Nursing Education Department continues to hold resiliency sessions for frontline direct care staff. I can tell you that, as you all know, this has been a long year and a half, and we hear from many of the professionals that they're feeling burned out. So we have an opportunity for people to talk about it, talk about how they're coping with it, talking about how they're kind of finding a new way to take care of themselves. So it's been very, very helpful, and Karen's been really leading that. I just want to thank Karen for her efforts in that regard. Very important. Terrace View received America's Best Nursing Home in Newsweek, so we're very proud of Terrace View. This is our statistics, and I apologize, it's blocked to the right there. You can leave that, Adrian, it's okay. What's most important in this chart is the what's called the SIR, which is a statistical representation of how we're doing with each of those quality statistics, catheter-associated urinary tract infections, central line infections, and then C. diff, which, as you know, is mostly created by an antibiotic use. But those three are the big areas we get measured on through multiple measurements, federal and state and otherwise, and insurance companies. But we're doing well with central line and with catheter associated, but with regard to C. diff, we're actually above the SIR. So we're continuing to work on that, and Dr. Murray and Karen and Donna have teams that are continually working on that. Sometimes they are actual processes that we need to change, and sometimes it's documentation. So it's a multi-pronged approach. So I don't know, Donna, if you have any comments with regard to this slide. Donna Jones.
Hi, I think you covered it. We'll just continue to have those multidisciplinary teams to really focus on these. And we're going to ensure that specifically the antibiotic stewardship committee is continuing to work diligently on identifying issues related to our C. diff incidences. So we continue to strive to seek improvement there.
Can you put your phones on mute, please? Whoever that is. Thank you. Sorry, Charlie. Sorry, Donna.
Okay, thank you, Donna.
No worries, you're welcome.
Human experience scores or patient experience scores continue to lag. Again, we're not alone. Many places have had the same issues with all the wait times we have, and people waiting hours on end in the ER continues to be a challenge. And you see that N number has gone down significantly, so it's about 200 under. So just the next slide, things that we're doing to help address the scores. We have monthly meetings, and that's by unit, so we can look at each unit and how they're doing, and then work on strategies by unit. So Karen is very involved with that with Donna Brown. We have bi-weekly human experience virtual training that we're doing for our employees, and we also have what we call re-engagement pop-ups, where we go to with staff and kind of on a very anecdotal basis, for lack of a better word, with them to talk about how we can move forward during COVID and remind people why we do what we do. With regard to our culture and HR, I'm sorry, my hand's a little fast here. We did an ED staff recruitment event on the 14th and 15th in open house in our ED, so nurses got a chance to see our new emergency department and interact with our staff. We actually recruited 10 nurses out of that event. We have another 6 that are starting, so it was very, very effective, and I want to thank HR team and Karen Zemansky for their efforts because again, it was very, very successful. We continue to raise awareness around diversity, equity, inclusion, and we actually had a vendor fair. It was great for people to gather again. These events are very welcome. We obviously continue to have our large gatherings outside, but employees were really engaged. Also, WUFO, we did a health fair for WUFO. We had the ECMC MWBE seminar, and again, continuing to engage the community and help our women and minority-owned businesses get certified. We had a pathway celebration for our, as you know, this is kind of the top designation for nursing. Magnet is kind of the highest, and this is the kind of designation on a journey towards that. So Karen, I don't know if you want to talk a little bit about the pathway celebration.
Well, this is our midpoint. So they actually 2 years ago, were going to announce our designation along with 300 plus hospitals nationally, but due to COVID, it's been delayed. So they were able to announce our designation nationally, and we just decided to have a little celebration throughout the hospital, throughout the areas, and just take that moment to pause, reflect on everything we had to do to achieve the designation, and remind everybody that in 2 more years, they have to do it again. So it was all very good though.
And Karen, just to remind the board, how many projects do we have from our nurses to improve patient care?
Oh, we probably minimum have at least 140 plus projects, and people every day come forward with more items that they would like to improve, either the facility or something on their unit or self-care or something for the patients. I mean, it's just, it really is a robust process.
Yeah, and it's really an opportunity for the nurses to have a voice in care and the operations, and actually come up with an idea and see it, you know, come to fruition. So it's very energizing for the staff, and Karen's done a really nice job running this program. The executive team, Rock Out Hunger, came to ECMC and did a live radio remote, and I just want to thank the executive team who reached into their own pockets, and we raised $2,500 for Feed More Western New York. So the staff here just did a great job getting food for Feed More Western New York and filling bins, and we as an executive team just wanted to support that effort and our employees because they just did a phenomenal job.
Did you enjoy the jigster?
I enjoyed the jigster. He's a very nice guy.
Was that you on the left or the right?
I don't know. Let's see here. I gotta figure out. It's a mask. You can't tell. Andy or somebody, do you want to talk about the Mark Scotch bike ride?
I can. It's Peter. I can tell you a little bit about it. Mark Scotch is a living donor for kidney transplant, and he is now on his second effort to ride from the East Coast to his home state of Minnesota to raise awareness on living kidney donor or living kidney donations around the country. And so he's a very passionate individual. It's a very, very interesting story how he got involved with it. It's pretty long, so I won't tell you the whole details, but we were glad to welcome him here a couple of weeks ago on his ride across several states till he gets back to Minnesota.
Great. We got some nice press out of that. Thank you, Peter, for our kidney program. Just again, some of the recognitions we continue to do throughout the hospital recognize our ECMC family. We had Pharmacy Week, so our pharmacists had an opportunity to get recognized. They've been doing unbelievable work with you know, a lot of staffing challenges, and pharm techs are really hard to hire these days. So they've been doing double time here, making sure that our patients get what they need. We had a portrait unveiling for Anita Dorr. For those of you who do not know Anita Dorr, Anita Dorr was here many, many years ago with E.J. Meyer and was the person that created the crash cart right here at ECMC. And she also started the National Emergency Nurses Association across the country. So representatives from the National Nurses Association were here, and also her family, who's there on the right. And it was really a nice ceremony. Karen did a really, really nice job, and it was a long time coming. We wanted to do this last year, but obviously during COVID we weren't able to do that. But she really was quite a force here, and obviously as the inventor of the crash cart, and really kind of transformed what should be by the bedside also for healthcare. Some foundation initiatives, just to let you know, we're continuing to work very, very hard to raise money and to also spend money where appropriate. And you can see the foundation actually awarded 26 nursing certification scholarships and 5 for CNA, full tuitions actually for CNAs in 2021. We launched our annual fund campaign, so give early and give often. And I'm sure Sue will be reaching out to you regarding our annual campaign. And we did an employee appreciation lunch recently, the foundation did, for all the efforts of the staff, especially while we were dealing with being short-staffed due to the vaccine mandate and also the strike at Mercy. Crucial catch, we had a couple employees join the Buffalo Bills on the field for the Crucial Catch game, and it was just a really nice event, and you can see Megan and Ursula were able to represent ECMC. We actually had some nurses sent up to us from New York Presbyterian Healthcare System through the governor's office, reaching out to them, and also I sat on the board with Steve Corwin, who's with New York Presbyterian. It was a week, but and 6 or 5 people, but it was very, very helpful and just a nice gesture from our friends down in New York City who wanted to come here and help. And it was a good opportunity for us to share with them some of their practices and some of ours. We just were very appreciative that they did that. Operations, so we continue to manage our census. It's very, very challenging to manage census these days, but the team's been doing an unbelievable job. Becky Del Prince in case management has really had to be creative in how we place patients. I've been working with some of the nursing home owners, as has Andy Davis. Karen's been working with Office of Developmentally Disabled Individuals to try to place them. We actually have 6 individuals here right now who have been here anywhere from 100 days to a year because we can't place them in group homes. So it's really a challenge these days. We continue to have daily bed huddles 7 days a week, twice during the week, once on weekends, and the team has been trying to support our team here, the front line, to help move patients through the system. We have a leadership change at Terrace View, and we're in the process of doing a search there. The Windows project has been moving along. It's been very challenging to have the Windows project, especially with all this volume, but we're committed to getting it done. And has been taking some rooms offline, and the front of the building will actually be done 12/1, so you don't have to look anymore at half the building being done and half the building being not done. We also were nominated by New York State for the Minority Women Owned Business Enterprise Champions Award. So really an honor from New York State recognizing the best programs across the state. And then finally, as you know,
Here comes the drum roll.
The drum roll. As you know, Karen Zemansky, as I sent out to you, has decided to retire, and I'm still dealing with that. But Karen deserves to retire, obviously, and we're very, very happy for her. She has made tremendous contributions to this organization and really been the leader of the culture in many, many ways here. So we will appropriately gather to thank Karen and for everything she's done here, and recognize that she'll be spending more time with her family, rightly so, and really focusing on herself, which she should be doing, because she's focused on us for so long. Karen will be staying on with us in a part-time role to help us with our accreditations, so we thank her for agreeing to do that. And we're commencing a search immediately. Dr. Cloud has agreed to do that, our Associate Medical Director, as well as Jillian Brown, who's our Vice President of Behavioral Health Sciences at RN Nurse. And I have been calling various members for the committee of individuals throughout the organization, nurses, doctors, and others who will be sitting on that committee. So we'll look forward to that process. And Our goal is to wrap that up sometime in early January. Then obviously here's our statistics. Obviously they don't look very good because we have not been able to get people out of the building. But as you can see, everything from our discharges being down to our length of stay being up. I'm going to drop down to the emergency room visits. While that says that we're down significantly, we actually had in the month of September, we had 800 left without being seen in the ER. The previous year we had 200. So just to tell you the magnitude of how many people, how we can't get people to the system. So that number would be a plus 140, 139, if we had those 600 people been able to get treated in the ER. So our volumes are not actually down. We have a lot more people coming to the ER. We just can't get to them in a timely manner. And again, Buffalo General's dealing with the same issues, Suburban's dealing with the same issues, as I'm sure the Catholic health system is also. But with that, if there's any questions, be happy to answer them, and otherwise I'll turn the agenda over to Jen.
Tom, when they leave like that, do we have a way of knowing where they went or where they go?
We really don't. Karen, do you want to talk about our left without being seen? And you know, we really don't have a mechanism to track where they go. Correct?
We really don't have a mechanism to track. Obviously, we would like no one to leave, and we do our best with care initiation and offering the televisits prior to them even coming into the emergency room to try to take our volume and tier it in different ways. But we do not know where they leave. Some end up returning within 24 to 48 hours. We are able to track that amount. But all in all, it's their individual decision to leave. So I'm hoping that they utilize urgent care centers. Probably not other institutions because they're also very busy like we are.
Thank you.
Are we referring people to urgent cares?
We can't refer people. We can suggest it when they come to the ER, but we can't refer them there because it's an EMTALA violation. But we have been very public about the fact that if people do come to the ER, it's going to be a long wait. And if they do have symptoms that are not, if they're cold symptoms, to really use an urgent care. And we're pretty specific about that. So, and Clyde has sent the same, information out. So and the volume has gone up significantly in urgent care. Also in addition, obviously, because people can't get in the emergency room, so.
Two quick items before I ask John to go through the financial report. Tom has alluded to the fact that we will, at another time and another place, duly recognize Karen Zemansky. But and Karen, certainly on behalf of our board, I think you know that we love you to death, and we wish you nothing but the best going forward. And we will miss you, and are thrilled that you're going to continue to work with us. As some of you know, Karen has been here for over 30 years, and in many ways defines what our culture and what ECMC is all about. And at various times over those years, I'm sure her impact, maybe almost single-handedly, has kept us going. Yep. And so, Karen, on behalf of the board, once again, congratulations to you and your family, and best going forward. And we will have that big party whenever it comes to wish you well. So, thank you. How about a big hand for virtually?
Thank you very much. It's been a privilege and honor, really, in so many ways, to be part of the board and be part of ECMC. That sometimes that myself and ECMC are almost intertwined to levels I can't even tell you. So thank you very much. Thank you.
Well, thank you, Karen. You should know that in anticipation of your retirement, Tom and Andy have already requested 3 positions So if that gives you some measure of your impact, you can take that away. So anyway, we'll talk again. And Karen's effective date is 31?
January, the beginning of January.
Or this year or next?
Next year,
No, next.
Oh,
2022.
So thank you. The other thing, thank you, Karen. The other thing that I would suggest would be appropriate in a time and place also to be considered is, I had the occasion, you saw the patient experience numbers, and they're going down. And despite our best effort to deal with them, there are institutional and procedural and operational issues that impact that. But that said, I had the occasion a couple of times over the past week or so to spend some time in the emergency room visiting some people who were there. And I will tell you that almost to a degree that I've never seen, and I've been around here for a bit, what the folks down there are doing to move patients through, even though we've got 6 or 8 hour wait times and a lot of people leaving, the fact that we're even still, some of those people are still standing is just remarkable. So, Andy and Karen and Dr. Murray and Tom and certainly, everyone, on the team really deserves an inordinate amount of credit for making that happen. And I would suggest to the members of the board that if you have an extra hour or two, you may want to go with the proper supervision and you just have to watch it. I mean, it is an amazing thing to see, and virtually everyone's still smiling and still taking care of people and trying to do what they can when the entire deck is stacked against them. And certainly what's happened in South Buffalo and even as you suggested with Kaleida, has just added to it. But they continue to do what they do, and I mean, it is something special. So, I would, if any of you are interested in doing that, we can certainly work with Tom and Andy and schedule a time for you. Just sit there and watch this. Sit in the waiting room and watch people come in and out, or watch watch Air One come in with people coming in off the helicopter, or that bank of ambulances that, if you remember, it was not all that long ago, that we were up on that hill, where you couldn't walk up there, and one ambulance crowded the whole thing. Now we've got a bay of 12 or 15, and it's full. You can't drive through it. And so the passion with which the people working here are taking care of our patients is just remarkable. So congratulations. I mean, I don't want to declare victory at this point, but
No, and the team's done a good
you need to
job.
hear that, and the team needs to hear it because it is something special.
Well, and I think, as difficult as it is, I think the team's done a good job of communicating what the issues are, what we're trying to do to alleviate some of the, pressures of the building getting jammed up. And that communication is crucial to making sure people understand that we're doing everything we can to make things better. And, when I'm down in the ER, they talk about it. They say, we know all the things that you're doing, and that's because, Karen, Dr. Murray, Andy, others are down there talking to them and letting them know everything that we're doing to make sure we support them. And we've done some other soft type of things and feeding them and some other things to let them know we appreciate what they do. So I appreciate the comments. Thank you.
Yeah, just to show you where I'm at on all this, if I was visiting one of our, a very high-profile member of our community, and who's in the emergency room, and walked in, and they were complaining about the food, and I said, "Shut up." So, if that's the least of our problems, then we're doing good. So, anyway, congratulations and well done, John.
Well, those sentiments are very hard to follow up with a finance presentation. Just saying. But I would just ask the board if you could bear with me. If you hear me get out of breath, I've been dealing with some lung issues. So just thanks in advance. And I'm going to jump right into it. So as Tom noted, we've really continued to be extremely busy. And it really, the challenges externally in the market are showing up all throughout this slide. You can see it from the discharges, our inability and sometimes, really challenged to discharge patients. They're showing up in the discharges, but also all the way through, and most importantly on this slide, in the length of stay. You can see it in 2 days of a difference here from our budget. And this actually has grown in October. So this is probably the highest we've seen it in a very long time, but it has reverberations all the way through the emergency room, as Tom mentioned. And of course, since the strike and of course the vaccine mandate, we've had to pull other levers. Some of those are showing up on here as well. The pullback and suspension of inpatient surgeries certainly will have an impact and has in September, and that's continued, of course, into October as well. Next slide. So what does that mean? Well, what it's translated to on the top line here is a loss from operations for the month of about $5.6 million, and that's $2 million below plan. So we had anticipated a loss, but the anticipated loss was about 3.6. Again, really driven from inpatient surgery volume being down. We had to pull back on our outpatient availability, so our outpatient clinic availability, additional incentives for our staff to pick up extra shifts. As Tom mentioned, the length of stay. So as patients stay longer, being busy doesn't always necessarily translate to better operating performance. As those patients stay longer, we're not getting additional revenue, but we still have the expense to care for them. And so that does have an impact throughout the building and on the operating performance. I will just mention, excuse me, on this slide, that we're at really a low point in our FTEs during the month, about 3,400 FTEs. That's the lowest we've been all year, not by design. We've been trying to hire. As Tom mentioned, we have 500 open positions, but really it's been challenged just given all of the other issues.
John, are most of those nurses?
It really is all over the place, I think.
And that FTE does include overtime too, so it's not actual people.
Right, it's not actual people, it's hours.
What if you're gonna divide that by group, by job classification?
We have about 1,000 nurses, so, with the overtime, it's probably a little over a third of that.
Right.
Just RNs. That doesn't obviously include techs and LPNs and all that, just strictly RNs.
Gotcha.
Yeah. One of the largest areas that we're, that have open positions are the CNAs, as we've talked about at Terrace. Next slide. So this is just the monthly performance of really depicting what I've just described. And so we're about $2 million behind plan for the month. We also saw lower non-operating income. So just for everybody's reference, that's investment, unrealized gains and losses. So as all of you probably saw in your personal portfolios, the market did take a step back in September, and it's showing up here. Next slide. So as we look at the year-to-date information, coming into September, we were right on plan after the relief and the forgiveness of the PPP loan. So as we look at it now, given September's performance, we're about $2 million behind plan. As I mentioned before, we do anticipate, just given that we've had to extend some of those additional benefits, we're seeing the challenges still in length of stay into October. We do anticipate some unfavorable trends into October as well in operating performance. Before I get into COVID, are there any questions?
And we've got nothing hanging out there from the feds on any relief at this point?
Not yet. I will get to that in a minute. Yeah.
Maybe probably not going to hit till next year, we're guessing, but John's going to talk about it.
Yeah. So just keeping track of our COVID impact, we're at about $112 million from the beginning of the pandemic till now. We'll keep this going as long as it is still valuable information to the board, but just want to keep everybody's eye on it. Next slide. So to your point, your question, John, there is the phase 4 that's announced. That application has actually been filed by us. The deadline's actually today, but we had filed it already. And so we don't know when or how much we may be in line for. They won't
Do
tell
we
us.
ask for a specific amount, or is it,
No.
we show
It's an
them our-
informational gathering application that they then use to determine.
Can you talk about the period of time and what they asked?
Right, so they've carved it up into 2 buckets. 75% of that 17 billion is being allocated for lost revenue and expenses from July 1st of last year through 2020 through March 31st of 21. And so they've asked for all that information, which we've provided. 25% of the 17 billion is carved out for what they call bonus payments, which are set aside for providers like ECMC who have typically cared for, and during this period, cared for a disproportionate share of Medicaid and Medicare recipients. The thought there is that organizations like ours who care for these folks were left out of some of the larger payments potentially because of the formulas in the beginning phases of the relief. So while we're cautiously optimistic, we just don't know how much or when it'll be awarded.
They basically take all the information and do whatever they do at CMS and they'll spit out this is what everybody gets paid. So, but they don't let us know what those formulas are. I don't think they know what the formulas are until they get the data.
Does this come through the state, and do they get to whack it up, or is it
This is
individually,
directly from the feds.
each institution?
Yeah, we'll one day wake up with a wire transfer in our bank account if we're so lucky to have received the award, just like the other phases.
So to ask the question, and I know Jen is thinking, is there any opportunity to impact any of this with any of our?
We've
That's what you were thinking, wasn't
It
it?
would be in fact wasn't.
we have been very vocal to our federal officials, and obviously I think like the American Essential Hospitals, and which is all safety net hospitals and Medicare and Medicaid, and AHA, I'm sure too at some level. We've been pushing for help, especially the safety net institutions. So I'm sure that the push from all the safety net institutions across the nation to their senators and Congress folks had a hand in that formula being developed. But CMS really, because they're looking at it nationwide, it's hard for an individual congressperson or senator to say, steer the money to this state, or they really do it from a formulaic perspective. So it's hard to influence it, but we have asked and they have sent letters, our Congress folks and senators to weigh in on this, and that, just getting it released was a big deal, because they've been hanging out of this money for a year, right? It's been probably about maybe not that long, but pretty close. But they really do. It's in CMS. It's that there's really nothing to do other than get the money released.
I would add to that is that just last week we were on a call with one of our local congressmen's office, and they did offer if we needed any help technically in the if there were any issues with them accepting the application or things like that, they could help, but probably not, to Tom's point, influence the formulas at this point. So we're kind of in a waiting period. They did say that they would try to gather all of this on the due dates today, so they'll have all their information tonight, but they'll be going through that probably the better part of the next 2 months, I'd say. The only other thing I'll mention is, we continue to monitor our year-end items that are actuarial type things in nature that typically come about at year-end. If you remember last year, we had some negative items that came through, in particular the pension, just given the sensitivities around rate, market performance, and timing. We're looking at those. Some of those are are headed in a positive direction, we believe, but we'll keep the board updated as we know more, as we get closer to the end of the year. Oh, I'll stop there and answer any questions if you have any.
Good, anything else? No. Thank you, John.
Thank you.
So when we move right to you?
Oh, you're asking me that question? Oh. Happy to talk to you in the executive session on the timing of
Okay, just a couple of things on the, just from the executive committee. Our governance committee met earlier this afternoon. Thank you, Sharon. Really nothing to report at this point, and we had a lot of ministerial stuff. Thank you, Councilor Calucci, and we'll move forward. I do want to remind everybody, because you've all should have received the invitation from Sue on the CEO roundtable, which is next Wednesday.
Third, I believe, right?
Third.
Yeah, third.
Next Thursday, whatever the day is. It would be my hope, expectation that you all appear and support the hospital in that effort. For the first time, I think ever, the event is at the Country Club of Buffalo. And the only reason we are there is that they've got a new president, and she assures us that it will be a spectacular event. Jody Johnston.
Board member.
As in Jody Johnston. Board member or is
Board
president?
Board member.
Soon to be president.
There you go.
So anyway, please put that on your calendars, and if you can't show up, you can write a check. So, but it should be fun. Mike Seaman, are you on the call?
No, he's not.
Anything else on the finance?
no, nothing else.
Mr. Bennett, Buildings and Grounds. Ron?
Yeah, mute.
Just let him know he's on mute.
All set, all set?
There you go. You're on now, Ron.
Always got a problem with that. Anyway, we had a short meeting. One of the things we talked about is the DK Miller building, probably one of the oldest buildings on the campus. It continues to deteriorate somewhat, but they're doing the masonry work to repair on that. As Tom mentioned, the placement is scheduled in January. In regard to the kitchen change, we talked about that last time. This is a new way to increase the efficiency for our food. The one line is already open now, and the second is coming and should be there shortly. And the expansion, one of the things that is different to this big building, like most buildings are, they have expansion joints to let the building settle so you don't crack the walls, and that's been work that's been in-house, and we're developing and replacing expansion joints in the floors, which is a pretty thorough job to be done. And that's basically what we talked about in this meeting. Thank you.
Thank you, Ron. Any questions for Ron? Ron Chapin on QI?
Yeah, good afternoon. The last quarterly meeting of the post-acute QI meeting for Terry's View was held on September 30th. We have traditional topics that we discussed: the medical director's report, COVID, Department of Health, and staffing crisis. In as much as these are very fluid topics, I would like Andy Davis to add or comment on these. The details are included in the minutes, are included in your board book. Andy?
Andy texted me that he's on the phone with the state, so I don't know if he's hearing us right now.
Well,
Okay. Yeah, sorry about that, Ron. Yeah, he's on the phone with the state regarding an issue, so he just sent me a text. But you know, with regard to the staffing issue, again, we're trying to hire like crazy. We're working with the union. We've been hiring different levels of positions other than CNAs to ask for some help again, the union has been great working with us, specifically AFSCME in that regard, our blue collar union. So it's been a challenge, and you know, the team has just done an unbelievable job over there with regard to the staffing challenges. And again, we're not alone, and we're working with some of the nursing homes to look at some other positions. Maybe we can have the state approve to be able to get staff. So, is there anything else you want me to cover, Ron, around the nursing home? Or?
No.
Okay.
No, that's about it.
Okay.
Thank you.
Thank you, Ron. Mike Hoffert?
Good afternoon, everyone. We had our quality meeting, and Donna Jones gave her quality leadership summary. Also, we had Dr. Paul Patterson, who reported on our hand services and some of the new techniques that they're using in that department. Dr. Flynn, he reported on trauma, and Dr. Cummings reported on behavioral services, and Karen Zemansky reported on nursing services, and finally, Charlene updated us on the upcoming Joint Commission inspections. That's all I got.
Thank you, Mike. Dr. Murray, just a quick question on that new procedure that we started a month or so ago. How is that going?
Well, those were kind of two one-offs. Actually, there's a second phase to those surgeries that has to be done several months later.
Just to remind the board, Dr. Murray, what the surgery was.
Basically, this was a new device based on what was formerly developed as dental implants, which is implanted into the bone of the leg in amputees, and it ultimately provides a much more comfortable and functional connection with the prosthetic limb. So the two operations, was the first phase to implant this device. The bone has to grow around it so that it becomes solid. Then there's a second procedure where the skin is closed and then an attachment is put in externally connected to that, which can connect to the prosthetic limb.
That was with Dr. Anders and.
Yeah, Dr. Anders, Dr. Laurie, and Dr. Ricard Brainmark, who has adapted his father's technology actually to this. He's from Sweden.
So is he here the entire time, or was he here for that?
No, he was just here for the day to assist with and help them do the surgery, the first couple of surgeries. I don't think they're going to attempt any more until they do the second phase on this. I'm waiting to hear.
At least to the degree that we know the patients are doing okay?
As far as I know, yeah.
It's remarkable. Anything else?
No, just next meeting, we'll be having a presentation on diversity, equity, inclusion. We want to make sure that the board's kept up to date on the efforts, and Cindy Bass has been very, very busy doing a great job, especially in light of the challenges we have with COVID and gathering folks. So she's been doing a really good job making sure we do trainings, making sure we have events, and so she's going to report on that next board meeting.
Let's also do something on the with Charlene on the
Joint Commission.
Joint Commission.
Yeah, happy to do that.
Okay. The only other thing that I would let the board know is that earlier this week, President Tripathi announced the appointment of Allison Bashir as the new Vice President of Health Sciences and Dean of the Medical School. I know Tom talked with her. I interviewed her at length, and I'm really excited. She is the current sitting dean at University of California, Irvine. And she'll be here in a couple of weeks. But I think, and I'm certainly hoping, that we'll have a new chapter in our relationship with the university, and specifically the medical school and the School of Nursing and Pharmacy and Public Health. At least on the surface, I think she's tremendous.
Yeah. I know she has a research mission, but she has spent a lot of time in hospital operations. So she met with Bob Musselbush, and I met with her individually, and she gets what we do. She understands how it works, and she understands our need to move from fee-for-service to value, and everything that's entailed in that, especially as we try to make sure we're sustainable as we make that transition. So she's really she understands that piece of it very well, so it's refreshing.
And I met with her individually and she came back for a second interview, so I was actually thrilled, but I think she's gonna be great, and I think when she gets here, we'll have her come to the board.
Yeah, absolutely.
I did talk with her about that, and she'd be happy to.
Great.
Happy to do that.
Awesome.
Okay, unless there's anything else for the good of the
I
order?
have a question, and I'm not sure if this is an appropriate time to talk about it, but in light of the direction that New York State is going with drug testing, have we changed our policy here at the hospital at all?
Yeah, we changed it a long time ago, actually. I think it's
Are
probably.
you talking about cannabis?
Yes.
Specifically with cannabis, yeah, I think we stopped testing for cannabis probably, I don't know, Joe, was it 2 years ago, 3 years ago? Joe Gilia? Oh, I don't know if he's still on.
He's still on,
Yes.
but I think you're right, it was more than a year ago, 2
Yeah, I
years
think
ago.
it was about 3 years ago, actually, that we stopped that. So.
Okay, so we're not doing that anymore?
Nope.
I did suggest at a meeting of the partnership this morning that, where this subject was being discussed, that we'll be opening up a Twinkie store someplace. It sort of got the same reaction.
Not here.
But anyway, I found it amusing. For the good of the order, sorry, Your Honor, I hope I did enough.
I don't know what you're talking about.
Thank you.
Safe place.
Thank you, Judge.
Thank you, Judge. If there's anything else for the good of the order, I'd be happy to entertain a motion to adjourn.
I will
Motion
make
made,
that motion.
second. Thank you, Chris. All in favor?
Aye.
Aye.
Stay safe, everybody, and thank you.